see. There's at least 6.
My name is Sonny Gazzardo, and this is a informative speech of sleep deprivation. This is my outline, this is my verbal citations. So with the introduction, we're going to talk about some forms of sleep deprivation and what causes it and who it affects. So between college students and grown adults working 9 to 5s, it can be more detrimental to their health than some forms of cancer. So people who have insomnia, they have difficulty falling asleep, returning to sleep, or staying asleep. Increased in women and older adults, and it is the most common sleep disorder in the U.S. Sleep deprivation is also known as insomnia among all ages and can have major impact on the actions of lives in people of all ages. People lose sleep daily in such a fashion that most have trouble staying awake during work, driving, or even in class. I'm sure some of y'all experienced that. Now we'll move on to the body. So what is insomnia? Well, according to the American Sleep Medicine Journal, insomnia is a classification of sleep disorders in which a person has trouble falling asleep, staying asleep, or waking up too early. It can cause fatigue, drowsiness, and can break focus when trying to perform tasks at work. And it can cause you to have trouble concentrating, and it can change mood disorders too. So a lot of veterans have it, mainly from the military's hours. I know Tommy could probably speak from that too. I was actually just in a recent sleep study for sleep apnea, so we'll see when I get back. Now we can move on to discuss how it affects people and how it's diagnosed. So diagnosing, there's no definitive test for insomnia, and doctors may use many different tools to diagnose it, but there are sleep studies and sleep logs, and they keep a sleep inventory, so they'll track your sleep over however many months. Or you can take an overnight test, such as what I did, and they'll see how your sleep pattern is in the first 2 hours, if you reach deep sleep, how long you reach deep sleep, and certain things like that. Okay, now, what lack of sleep can really do to you, it can result in advanced respiratory diseases. It can affect body weight. Not getting enough sleep prevents the body from strengthening the immune system, so it gets sick easier. And it will prevent this from producing cytokines to fight infection, so you can easily get sick from having lack of sleep. So there's different forms of insomnia: acute, chronic, and onset. Acute is brief episodes of not being able to sleep. Chronic being long-term, which a lot of veterans have, a lot of older adults have. And onset, which is difficulty falling asleep at the beginning of the night and not being able to stay asleep during the night. And that's also common amongst adults, mainly because work hours these days are getting more strenuous. So here's an example of a sleep log. It's kind of crooked, but it's something you would fill out either by yourself or your physician would fill it out as you go through your sleep study. And then there's some medications that can help keep you asleep or help you fall asleep, depending on what your problem is. And if you think you're having problems sleeping, always see a doctor for help. In the conclusions, I have discussed insomnia and how it affects people at certain ages and who it affects mainly, which is veterans and older adults and women. I informed you about how insomnia affects those diagnosed with it and how to diagnose it. And last, I gave you information about the different types of insomnia. And if you find yourself falling asleep behind the wheel, in class, or unable to concentrate at work, please seek the help of a physician.